Good morning. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety. Welcome to our weekly COVID-19 briefing to talk about how the state is responding to the COVID-19 pandemic. Today is Thursday, October 8th, 2020, and today we'll be pleased to introduce Governor Herbert, who will be followed by Justine Lee, the Director of Elections. We will also have Dr. Dunn, the state epidemiologist, and Dr. Emily Spivak from University of Utah Health. Governor Herbert.
Well, thank you, Joe, and welcome everybody. As always, we're honored to have you here on this kind of weekly briefing that we have, and an opportunity to talk about a number of things today. As most of you know, we had a unique and unusual opportunity to host the vice presidential debate last night at the University of Utah. And I certainly want to congratulate all those who were involved in making that happen. For a few hours, Utah was kind of the center of the political universe as we had two capable candidates running for vice president address and discuss about issues. So congratulations to the University of Utah and the Debate Commission, all those who made that possible. It was a nice opportunity for Utah to, again, kind of host the world as we've done in times past. I think as I look at politics, certainly there's not necessary proportionality to the different offices that people run for. And it really does not necessarily have anything to do with the importance of the office. Certainly the president gathers a lot of media attention, and people are wanting to know about the president and who's running for president, vice president, at the top of the list of those running for office. But I'd like to say, as a former elected official at the local government level, how significantly important those running for county commission, our local government folks, whether they be recorders, clerks, people involved in our attorney general's office, our county attorneys, those are very important offices too, that we all have a chance to weigh in on and vote and let our voice be heard. We have opportunities, in fact, to vote here on coming on November the 3rd. We have 4 congressional districts up that are being contested in our House of Representatives on the federal level. And again, new governor opportunities, state auditor, treasurer, the attorney general, and as I mentioned, the local county offices and others. In addition to that, I think we have 7 different constitutional amendments that are going to be voted on. So a good slate, good issues, good candidates running. We appreciate those who've thrown their hat in the ring and say, choose me. That's not necessarily an easy thing to do. But I want to remind everybody out there to, in fact, get out and vote, let your voice be heard. Make sure that you take the opportunity, in fact, to vote. To that end, I've invited the State Elections Director, Justine Lee, to come here and talk a little bit about the process so that we make sure everybody's up to speed on what we're doing here and how we do it here in the state of Utah. So, Justin?
And thank you, Governor. Good morning. As voting has started in many states across the country, you've probably seen reports of long lines at polling locations. Fortunately, here in Utah, we have a way to avoid these long lines and to save time by voting through the mail. We've been conducting our elections through mail for several years now with great success. One of our successes is that we have a very good working relationship with our local post office officials because we've been running these elections by mail for so many years. We've had many discussions with our USPS officials this year and are confident they can handle the volume of ballots that we will have running through the mail system. Voting by mail is not new for us, and it's not new for them. Voting by mail is safe, it's secure, and every vote is counted. So please take advantage of this great resource. There's no easier way to vote than by mail. Now, the big question we're getting is, when will ballots start arriving? The good news is it's only a few days away. Ballots will begin hitting mailboxes in the next few days. In the meantime, you can check your registration status, or you can research the candidates and issues that will be on the ballot by going to vote.utah.gov. If you're not registered to vote, you can register to vote until October 23rd at 5:00 p.m. Now, once you receive that ballot and you mark your ballot and want to turn it in, you have until November 2nd to postmark that ballot, or you can drop it in a drop box in your county anytime through 8 p.m. on election day. And getting the ballots early allows you to take the time to research the candidates and issues and make decisions in the comfort of your own home. Anyone who waits until Election Day runs the risk of standing in a long line at the polls. And when you get to the front of that line and get your ballot, you may be disappointed to find out it's the exact same ballot that was already mailed to you. And you'll probably just be pointed in the direction of the nearest drop box to submit that ballot. So really, our polling locations are reserved this year for those people who need extra assistance. If you lost your ballot, if you never received your ballot, or if you're one of those voters who needs to vote on the 88 accessible machines, that's when you should show up to the polling locations. In a year with a pandemic, it's vitally important that we maintain physical distancing. Voting by mail or dropping your ballot in a drop box will keep us safe. So please save time, stay safe, and vote that by mail ballot. Thank you.
Thank you, Justin. Again, let me just thank those who are running for office. It takes a little courage to throw your hat in the ring and say, choose me. Not for the faint of heart, but it's certainly a necessary process. It's what makes America great. It's what makes Utah great. So we appreciate those who are running for office and wish them all well in that effort. Now we'd like to turn some time to Dr. Angela Dunn, our state epidemiologist, again, who's here to give us kind of the weekly report on the pandemic. So, Dr. Dunn.
Hey, good afternoon. Today, our 7-day rolling average of new cases is 1,114 cases per day. 1 week ago, we were at 987 new cases per day. Our percent positivity is at 13.7%. Last week, we were at 13.6%. And there are currently 237 patients hospitalized with COVID-19 in Utah right now. And Dr. Spivak will be on momentarily to talk about the strain that this has been placing on our healthcare providers and our healthcare systems. You know, it's been about 1 month since we started this surge, and the age distribution of new cases is now spreading across all adult age groups. It's no longer just a surge in our 15 to 24-year-olds. And this is evidenced by our increasing hospitalizations and deaths. But we are seeing some encouraging trends. At the beginning of the surge, Utah County was accounting for approximately 40% of our total state's new cases. And this past week, they are currently at 30% of our new cases. And of the 18 small areas in Utah County, only one of them is in an increase. The rest of the county has seen a decline in new cases every day for the past several days. This is an example of the success we can have when we come together as a community with a renewed focus. Elected officials, universities, businesses, public health, schools, and most importantly, the residents of Utah County made the decision to change their behavior, whether that's wearing face masks when they're out, practicing physical distancing, and staying home when they're ill. They reignited their commitment to stop unnecessary illness and death, and this has worked. Let's all use this as an example for statewide action moving forward so that we can get control of the spread of COVID-19 here in Utah. Thank you.
Again, we thank Dr. Dunn as our state epidemiologist. She is a main player in our unified command, and the facts that she brings to us, the research being done, helps us to be informed as far as what we're doing, how we're doing, and what the policies that we have to recommend to improve the outcome. And so we appreciate the good work of Dr. Dunn and others on our unified command. As we've seen these case counts increase, as Dr. Dunn has talked about this past month, it's caused us a lot of concern on many different levels and many different areas. I understand that the fatigue that's taking place now with many of our first responders, those who are providing the medical services, the healthcare systems itself, is under some stress. So I've invited Dr. Emily Spivak from the University of Utah Health Department to come and speak to us on this issue. She's the Associate Professor of Medicine in the Division of Infectious Diseases. So, Dr. Spivak.
Thank you, Governor Herbert, and thanks for the opportunity to be here today. As you've heard from the governor and Dr. Dunn, the rate of positive tests in our state is of huge concern, and things may be getting worse. Once again, we ask that all citizens wear a mask to minimize the risk of getting the virus and, most importantly, of spreading it to others. As a physician, I honestly don't know how this became a debate, but the facts remain clear. Wearing a mask makes a huge difference. It is a fact, they work, and they are safe. We all have a choice. We can choose to wear a mask whenever we are outside of our homes, or we can continue as we are now, and we will keep having this conversation over and over. If we choose the latter, we can all plan on remaining in this current state of uncertainty, experiencing lockdowns, virtual schools, canceled sporting events, holidays without loved ones, and continued economic and personal financial impacts, and more people's lives devastated by COVID-19. I can tell you as an infectious diseases physician, working behind the scenes to help our frontline providers care for COVID-19 at the University of Utah day in and day out, our hospital is getting full. Our ICU is getting full. Our ICU is 95% full this morning. Our healthcare workers are tired, they're suffering, and they don't want to see another person die alone of a preventable infection. In addition, if we continue to ignore science and medical recommendations, we will not be able to offer the best quality care that our community deserves and expects. So as a physician, a mother, a concerned citizen, I plead with you, wear a mask at all times when you are outside of your home. This means you should wear a mask when you go for a walk, in case you run into a neighbor who would like to chat. Wear a mask when you're in a store. Wear a mask at your child's sporting events. Make sure your children are wearing masks when playing with friends or playing sports. You should even wear a mask if you're outside with groups of friends or family members who don't live with you. You are not only hanging out with them, but hanging out with everyone else they have been in contact with. So feeling comfortable with someone doesn't mean that you cannot get COVID-19 from them. Don't overthink it, just wear a mask. There is not a single Utahn whose daily life has not been impacted by this pandemic in some way. Sadly, over 500 Utah families have lost a loved one to this pandemic. For the rest of us, we face economic hardships, challenges to keep businesses afloat. Our children struggle to succeed in online education, being away from their friends, and their teachers struggle to do the very best to provide meaningful learning environments, and many of us are separated from our extended families for the foreseeable future. Our frontline healthcare workers continue to fight tirelessly to care for our community members with this virus. The longer our community fails to wear masks and treat one another with respect, the longer we will continue to face these challenges. We must come together as a state and a community if this is to ever end. We need you, and we need all of you. Thank you.
Thank you, Dr. Spivak. We appreciate the work of our healthcare providers. Again, those are the folks on the front line. They're not immune to getting the COVID-19 virus themselves, and many have. But they're there, they show up every day, and they too are getting weary of this long time experience we've had. It's been really 7 months since we've declared an emergency here in the state of Utah, really addressing this pandemic. And the 7 months seems like 7 years for a lot of us. It's been an ongoing, frustrating experience that's unique in the annals of history of Utah, certainly in our lifetime. And the closest maybe is the 1918 Spanish flu epidemic. I think this is more permeating throughout the world, and it's been an interesting experience for all of us to go through. I know the spiking that we have, as I've mentioned, this is kind of like whack-a-mole. We get something under control and something pops up somewhere else in our state, get that under control and something pops up. And it is frustrating for all of us. And that frustration, I think, turns into sometimes anger. And I understand those things. And so let me just make mention of a few things, again, by way of my own editorial comment today. And I hope that in doing so, our eyes don't glaze over and we say, gee, we've heard this before. Because most of the stuff I'm going to say, you probably have heard before. Doesn't make it any less important. Doesn't make it any more rational for us, in fact, to follow the advice and counsel given to us by the medical experts and the scientists and those who really care about the health and well-being of our people. And also following the advice of those in the private sector, in the business area, they're saying, we want to make sure that our economy doesn't close down, which creates another set of problems. As we said before, we've always tried to strike the appropriate balance. That balance being the optimal outcome. As I look around the country, it is interesting to me to observe 50 different states all addressing this issue in different ways, with nobody seeming to find the magic formula for success. We have about 20 states now that are spiking just like Utah is. We're in a good place. Now we're not in quite as good a place when it comes to the case counts and the spiking, the infection rates. Everybody's kind of taking their turn and having the ups and downs. Some states that had a really bad infection rates and a lot of deaths now have very low case counts. Not everybody knows why. The scientists are a little bit puzzled. We're learning as we go. It really is an interesting experience and an experiment in how we, in fact, work together. We are a unique culture in Utah that I think allows us, in fact, to have better outcomes than most other states. We have a healthy economy. We've been financially prudent. We have a rainy day fund. We have a diverse economy. And so, at least on balance, we're in much better shape than most states to come out of this pandemic with good health of the people here, fewer deaths, and a healthy economy. That doesn't mean we're not struggling, though, and we don't have room for improvement. And I would hope that all of us will understand that we all have a role to play in that effort. And it's not somebody else's responsibility. It is all of our responsibilities in whatever role that we're playing to do the best that we can. And we ought to ask ourselves, what can I do to help improve the circumstances and the situation? We've been called upon by the business community. We just had an announcement last week of the effort of the private sector to say, let's stay safe to stay open. Obviously, having the pandemic under control allows the economy to unfold and have our society more normal. Having job opportunities, economic growth to help pay the bills and the individuals and families is an important aspect of quality of life and certainly the health of us as individuals and as Utahns. We appreciate, again, all the work of the medical providers that are learning as they go. We have increased hospital utilization right now. That's the bad news, and it should be a significant concern for us because we do not want to overwhelm the healthcare system as we've seen in other states. But because of the good work of our doctors and our medical advisors and experts, our scientists, we're having a shorter period of stay when we go to the hospital. People are having less severe reactions because of early treatment. We're doing better when it comes to testing. More people are getting tested. And that helps us to track and trace and isolate and help slow down the spread. Utah, again, has a great culture. We've talked in terms of past, of Utah leads the nation when it comes to volunteerism. We actually really care about our neighbors, even those that we don't know personally, but they are our neighbors down the street, down the block, in the neighboring city. We are number one in the nation when it comes to charitable giving. We are an optimistic and hopeful and happy people. Again, at the top of the list in every polling. We need to bring those good qualities to bear here with this pandemic. A pandemic by its nature has these spikes, these ups and downs, and it does cause frustration. It's causing a kind of finger pointing, blaming of somebody else, backbiting, criticism that is unwarranted. It is not helpful to us working together to solve the problem. But together really is how it's going to happen. It's going to be all of us working together, doing our part, even doing a little bit. It may be, for those who don't want to wear a mask, I understand that some people have an aversion to that. It's almost a political statement. I don't quite understand it, but I understand it. But find something else that you can do. Maybe gather in smaller groups. maybe stay more outdoors and less indoors. Help others to follow good protocol, good hygiene. If you're sick, don't go to work. There's things you can all do. All of us can do something. And if we all do something, we can get a lot accomplished as we try to win this war against this pandemic that we have here in our state today. I appreciate the fact that the business and the private sector stepped up saying we can do our part and have programs out there of stay safe and stay open. Again, we have many grocery stores and retail outlets that are joining in with that effort. Our chambers of commerce are at the forefront throughout the state, trying to make sure that people feel comfortable when they go to shop. They have a safe environment, and we appreciate the work of them in trying to do it. Our medical experts, our hospitals, our healthcare people, our science and data, tracking trends, giving us data and facts to help us find good policy will get us to a happy and better outcome. And it is working. We appreciate that. I'd like to also mention, again, our faith-based organizations. They do so much for us in the state. Sometimes they don't get all the credit they deserve. But when it comes to having people improve their behavior, church and faith-based organizations are designed to, in fact, do that. Their motivation is one of internal aspect as opposed to government's kind of an outside forced choice. Churches and faith-based organizations help us do the right thing because it's some internal belief that we have in maybe a higher power and a greater calling for the common good of our neighbors and our friends. I want to read again a statement that was released on June 24th of this year. These are from faith leaders across the state, Christian and non-Christian, all joining together for a common cause. And this is what they said. It's just as appropriate today, maybe more so, than it was 3 months ago when it was released. And I'll just quote it. It says, over the last several weeks, we have seen alarming increases in COVID-19 infection rates in the state of Utah. The state epidemiologist has identified the lack of masks and social distancing as key factors responsible for this increase. As faith leaders, many of us have seen the effects of this virus on vulnerable persons in our congregations. COVID-19 has caused so many disruptions in people's lives, including mental, physical, and financial stress. We, the undersigned faith community leaders, appeal to people of faith all over the state to wear masks and to practice physical distancing, sacrificing a small measure of comfort for the sake of saving lives. We recall that the greatest commandment is to love God, and the second is is like unto it, to love one's neighbor as thyself. One cannot claim to love one's neighbor while deliberately putting them at risk. Let me read that again. One cannot claim to love one's neighbor while deliberately putting them at risk. We pray for the end of this devastating pandemic. However, the reality is that our actions must accompany those prayers. Please join us in continuing to take action to prevent the further spread of this pandemic by wearing masks in public and maintaining physical distancing. All sectors of our community are really engaged in trying to convince us, individuals and families, to in fact modify our behavior for the good of the whole, for the good of the people that we associate with, for our family members, for those who are most vulnerable in our population. It really is a combined effort by all of us that's going to lead us to the success and the optimal outcome we all are praying for and hoping for. We've had experiences of this in the past, only in a different kind of catastrophe, a different kind of disaster. The pandemic is very unique. It hasn't happened in our lifetime to the extent we have seen here with this coronavirus, this COVID-19. But I can think of many times in this state where we've had fire, floods, water, mudslides, windstorms, Category 1 hurricane, over 100-mile-an-hour windstorms where it's left devastation in its path and a lot of work to be done by somebody. I've seen the people of Utah, this last windstorm is a good example, rally around their neighbors, people they did not necessarily know, and say, I've got a chainsaw, I've got a truck, I'm going to go out and start helping clean up my community. I'm going to help people that have been displaced from their home and find a place for them to live and give them shelter, give them food, give them medicine. Like a little anthill, these people get together in their communities and say, we can work together to overcome this disaster. We saw that just a few weeks ago here with this windstorm. That's the type of effort we've got to have here today on this pandemic. We don't need people to point the fingers about who's at blame and who's the fault. We ought to say to ourselves, what can I do to make it better? Let's see if we can all be a part of the solution and not a part of the problem. It's a little bit disturbing to me and certainly disappointing where I see people out there intentionally trying to pour kerosene on the fire and bring division to this effort, where we should be united in our effort, finding ways to work together, finding common ground, common approach. We find some out there trying to create division in the ranks and really becoming a hindrance to us solving the problem. So today I call upon all of us to look and see what little things can I do better than I've done in the past to help us stop this spiking that's going on and get our case numbers and the transmission rates and the infection rates down in controllable numbers, to make sure we don't overrun the healthcare system, our hospital beds, to give some respite to our medical frontline workers that need a rest because of all that they're trying to do to accommodate this surge of people needing medical help. If we can do that, I think we have a chance to, in fact, get this in a controlled position to minimize the risk and the damage and the disaster that's taking place until we get a vaccine. As I said last week, I think a vaccine, it's not a matter of if, it's a matter of when. Hopefully by the end of this year, or certainly the first part of next year, we'll have a vaccine which will be able to distribute to the people of Utah and around the country to help us get back to a more normal situation. But until then, we got to roll up our sleeves and work together and do our part and find where we can actually contribute. With that, speaking of mask wearing, let me just conclude and talk about, we have a holiday coming up called Halloween. And so masks are the norm for Halloween, and we want to make sure that people have a safe and enjoyable, happy, safe Halloween, particularly for our younger people, but maybe not just our younger people, for those of us older that gather together in groups. We need to maybe think twice about how we're going to do that so we have a safe and happy Halloween. Trick-or-treating is mostly done outside. That's good. And we need to give you maybe some kind of guidance and some rules that are kind of common sense. But again, wearing a mask, and that means if you have a mask you're wearing for your Halloween costume, that doesn't help protect you or the others from spreading of the aerosols and the COVID-19 virus. So if you have a Halloween mask, wear a mask underneath it, a real mask that will help you with that spread. Against physical distancing of at least 6 feet. If somebody's on the porch, wait till they clear until the next group goes up there if you're family or friends together. We ought not to congregate for only a few minutes if possible. We're out doing our trick-or-treating. And to parents, don't let your kids eat the candy before they get home. It might need to have a sanitary wipe on the labels to make sure there's no virus that they catch as they get candy and gifts from people as they go trick-or-treating. Simple disinfecting wipe will do the job there. Again, just common sense, but again, a reminder, we've got a fun holiday coming up here, and let's make sure it's a safe and a happy one if we follow good, appropriate protocol. With that, we'll take a few questions right now, and so we'll start that part of the press conference.
KSL TV here.
Oh, go ahead, KSL.
Sorry, I was listening through the online. Anyways, we are wondering if you can speak to. We know that Dr. Spivak mentioned that there's 95% being reached at the ICU. Wondering if that's something that you're seeing in other hospitals, especially as we're going into the flu season here, and if that is one of your concerns, it may overwhelm the system to have both COVID patients being treated and then have to deal with the, yearly flu season.
See who would like to speak to Dr. Spivak? Would you like to, again, somebody can talk about load leveling and what we're seeing, because we see some space here and then we load level and then we end up running out of space. It's sometimes a false hope. So can you talk to that?
Thank you for that question. I cannot speak to other health systems other than the University of Utah. This morning, our medical intensive care unit was 95% full. We do have the capacity, and people are working to essentially build out other intensive care unit capacity, transition other units to be able to take care of intensive care unit patients. But for us, and what this reflects to me, to your point, is we are maximizing the system. Which way things are going to go, I don't know exactly. It is of concern to me personally, and at the University of Utah. I can't speak to other health systems, but it is a marker of things getting worse.
Yeah, and we're hearing from health systems across the state that they're also feeling the same struggle that Dr. Spivak has discussed. So it is a concern statewide, especially when our main referral healthcare centers are maxing out of their ICUs. That means that there's going to be limited capacity, as you say, as flu season ramps up and other respiratory diseases come in the fall. Are we going to eventually need to move towards crisis standards of care? And so it's really important that we do everything we can to prevent definitely COVID, right? Wearing your mask, physical distancing, staying home when you're sick, but also other respiratory diseases. You can get your flu vaccine right now, and we really need everybody out there who's able to get the flu vaccine to get it to limit the strain on our healthcare systems as well.
Let me just add as a postscript, I had an opportunity to talk to former Lieutenant Governor Greg Bell this morning. And as some of you know, he is the government relations fellow for the Hospital Association, where all the hospitals belong to that as an association. And his concern was, in fact, this spiking and now higher, as a result of the spiking of the cases, now more hospital utilization. And as we went over the numbers, just 4 weeks ago, we were doing about 115 beds being used for COVID-19. And today we're at 240 or something. So it's almost doubled. And that is a concern for the Hospital Association. So if you wanted to get, I'll just say to the press, Greg Bell would be a good person to talk to and follow what the different hospitals around the state and the association feel about this spike and the concern they have of overrunning our hospital bed space. And by the way, it's not just the beds. We about have 50% of our bed space is still available in all of our hospitals. ICU beds is a lot smaller number. We're utilizing probably about 17-18% of that with COVID-19 patients, but that's more than doubled over what it was again 4 weeks ago. So that spike has an impact. And it's not just the bed space, it's personnel to run. If you go to an ICU bed, you hope you're going to get ICU treatment with specialists and people that have that knowledge and that ability, skill set to treat you, rather than just like a traditional hospital bed. So personnel is a big issue. As again, you heard Dr. Spivak talking about the fatigue and the fact that we need to have some rest for some of our healthcare providers in our hospitals. They're getting tired and they don't want to show up to work. Next question.
Thank you, Governor. This is Chris Reed with St. George News. It's actually more of a question for Dr. Dunn and Dr. Spivak. Certainly here in southern Utah, we're starting to see an increasing death rate as well as hospitalization, like some of the rest of the state. 8 months into this, from a Utah perspective, are we getting any better at treating those who are hospitalized and preventing COVID resulting in death?
I'll address that. I would say nationally and even internationally, the quick answer is yes. We are getting better at treating COVID-19 patients. And that's simply because we know more about the disease, we know more about the infection, we have more treatments that are available. And we've gotten better at it. over time. At this University of Utah specifically, and as we've talked about in the state of Utah, our mortality rate for sure seems lower than other states, probably somewhat related to our baseline health status in this state. Additionally, at the University of Utah, we have access to some national data that our mortality rate looks better even than other academic medical centers and other medical centers in the West, which again, it's hard to tease out always if that's what we do or if that's sort of a marker of a healthier population here. But I wouldn't underestimate, again, the severity of this disease, that it can affect people of all ages, and that, out of the blue, a person who otherwise doesn't have health problems can be really severely devastated by this infection. I know we always talk about deaths too, but the morbidity, or let's say the long-term consequences of this infection, if you talk to anyone who's had it, they often do not feel right for a long time. And if they had it the last few months, they still may not feel right and will have long-term fatigue and other problems, even mental health problems, neurologic problems. So I wouldn't always just use mortality and death as a marker of the impact or the devastation of this infection, but really also think about how it's really altering and devastating everybody's lives.
Thank you. Next question.
Hi, Governor. It's Ben Winslow with Fox 13. So with the numbers that we have seen and these continuing cases over 1,000, and with the request from Salt Lake City to go to orange, are you considering any further restriction?
We're going to be meeting with our unified command to take a look at what we have in place now, see what's working and what's not working, and if there's a change that's going to be warranted. I'll be meeting next week with our legislative leadership to talk about the same thing. So stay tuned and see. There's obviously, as I've always said, there's tools in the toolbox. I'm reluctant to have a statewide mask mandate. We're doing some studies on mask mandates, and we're finding some interesting data points as far as does it help or hurt, particularly when it comes to the economy, which is a little bit of a surprise, but we're using the Eccles School of Business to help us do some data research there and see what that impact truly is. And so we're going to keep doing what works and change what's not working. But it's unclear. As I say, we have an observation capability of 49 other states. Nobody's come up with a magic formula to solve the problem. And they're all trying different approaches, from government mandates to just freewheeling, let it go where it goes, and everything in between. We've tried to have kind of an optimal approach in the middle, having local governments have more say about it, have them make decisions on whether there should be a mask mandate. We've seen that in Salt Lake County. We see it down in Utah County now. We see it in a couple of other cities and locations. And that seems to have worked for a period of time. Does it work forever? I know people just get complacent, ignore it's been so long that they forget or ignore it. I'm not sure. But we're going to continue to work together and see if we can find the optimal place to be, protecting people's health and protecting the economy at the same time. They're not mutually exclusive. Some people have said it's a Hobson's choice. There is no way to come to an actual happy ending on either of those isolations. It's what can we do together to find the optimal outcome. That's what we're trying to do. Next question.
Good afternoon, Governor and everyone. This is Sean Means from the Salt Lake Tribune. My question is mostly for Dr. Spivak, I think. Wanted to find out, sort of hear from you, sort of the ground level view as a healthcare worker of how doctors and nurses are coping with the surge in cases and hospitalizations and deaths. I mean, we've set new daily records today in both cases and hospitalizations. We've crossed the 500 mark on the state's death toll from COVID. What is it like in hospitals right now for the people that are working there and treating COVID-19 patients?
So I can, again, only speak to the University of Utah, and I would encourage you to reach out to some of our frontline providers for more sort of real stories from them. But I will tell you that I feel very blessed to work at the University of Utah, and I think many of us would say that, in that our administration and leadership is acutely aware, hour to hour, of our bed capacity, of our, as Governor Herbert alluded to, the people to support and to take care of these patients is almost the more important factor, as you're asking. And we have a very supportive leadership and administration who is very aware of these things. And I think most of our staff would tell you that they feel very supported and that they are doing the best that they can. But I'll tell you, there have been some personal stories shared with us at meetings from some of our intensive care unit nurses and physicians that are heartbreaking. And they feel very overwhelmed. So we feel supported, we have great leadership, but people are really tired. So I don't know what else to tell you, but.
I think we're all tired, and it's like we're in the third quarter of a very difficult contest, and we're just kind of going into halftime a little bit tired. We need to have maybe a modification of our game strategy. We need to have everybody in the team come together and put forth our best efforts. And if we do that, we'll win. We'll win this battle. But it's going to take us all working together to do it. Next question.
Oh, sorry, KBR is here. It took me a second to unmute. Hi, Governor Herbert. This is Sonia Hudson from KUER. We've been talking a lot about hospital capacity and hospital surge in the state. Is there a statewide plan if, ICUs get even more full and maybe max out their capacity? Is there a statewide plan to deal with that?
Dr. Dunn?
So hospital capacity is a key metric we've been measuring from the beginning of this. Our goal is definitely not to overwhelm our healthcare systems and to maintain good care, not only for COVID patients, but to be able to provide care for all diseases that need that level of care. So our hospital capacity is one of our key metrics when we look at evaluating specific counties on the level of restriction that they should be under. Because we know that physical distancing and mask wearing decreases the spread of COVID and decreases the burden on our healthcare systems. When we reach this capacity, we do have, as Governor Herbert mentioned before, a working group or a task force of all healthcare systems and hospitals in the state who work together on load leveling. So being able to distribute patients and care across the state so that patients can get the level of care that they need for their disease. This is part of an element of crisis standards of care, however, and as Dr. Spivak mentioned, there are plans in place to expand the number of beds, for example, that can hold patients, ICU patients and other patients. However, again, that is going into crisis standards of care, so it's not optimal. So there are plans in place if we need to get there, and we are trending in that direction, unfortunately. So what we really need is to actually decrease our case counts now and urgently so that we don't have to go into that crisis standards of care mode where ultimately patients might not get the type of care they actually need for their disease.
Gotcha. So is that changing regular hospital beds into ICU beds then? Is that what that sounded like?
So there's a variety of options there. We still have the option of, looking at the Mountain America Expo Center and putting beds there. There's options of expanding bed capacity, as you mentioned, in terms of turning regular beds into ICU beds. But the rate limiting step for all of this, of course, is people to care for the patients in those beds and making sure that we have the providers available and ready to provide that level of care. And that's not something that's as easy to come by as changing a bed into an ICU bed.
Thank you.
Just by, again, way of numbers, we have about 2,000 beds that are unoccupied now in the system. So again, turning them into ICU beds would be probably a first step, but that's not the problem. It's having the personnel there to tend to the patient. That's the big concern that we have right now. And so again, it's we need to reverse the trend and do our part to help that to happen. One last question.
Hi, this is Katie McKellar. Governor, where does Utah go at this point? If not a statewide mask mandate, what else can and will you do to get the spike under control, other than continuing to plead with Utahns to do the right thing, because that clearly hasn't been working well enough to stop this spike? I know you said stay tuned on what may come next after your meetings next week, but can the state afford to wait any longer at this point?
Well, it's all about behavior. And so the question really is, what's going to modify my behavior, your behavior? Does it mean that somebody's got to pass a government rule, a law, an ordinance to make you do that? Maybe for some, that's the only way they'll do it. But for some, they'll rebel even harder against it. We ought to, as I've said, do the right thing for the right reasons. I think it's a local decision to be made, by the way, in most every instance. They're accountable to the people that have elected them. They know their regions of the state better. They know what the challenges are, if it's an isolated neighborhood or if it's widespread in the community. They understand better. We do see change in behavior, by the way, that's taken place. Certainly a lot more people wearing masks throughout the state, including those areas where there's not a mask government mandate. And so I see things changing. We have spiking that's taking place, but that's taking place in every state, including those that have shut down the entire state economically and with mandates for masks statewide. So if we think that's somehow a silver bullet, that probably is not what we're observing across the country. And I do believe that there are differences in the states and the difference in their cultures, differences in their politics. And so, the one size fits all doesn't work. We're trying to find our unique Utah solution to address our unique Utah needs. When you think about 3.2 million people, of which 80% live in 4 counties, very urbanized here between Ogden and Provo, the rest, in some urban areas, like in Logan area or St. George area, the rest is all rural. Social distancing is just a way of life. And, having a mask mandate in Wayne County and some others of that same, some of our rural counties, we have 14 in green, probably doesn't make a lot of sense because it probably won't make any difference. So those are part of the things that we have to debate and discuss, and we do it every week. Our Unified Command meets every day. They look at the data. They look at the policies. They see is there ways to improve. And again, I'm going to have a review of everything we've done here starting today and through the first part of next week to see if there's other things we ought to be doing from the government standpoint. But at the end of the day, heavens, I hope that we don't have to have government tell us what to do the right thing. That's probably an indictment upon us as people. Again, as we've seen Utahns rise to the challenge in times past, whether it be fires and floods, whether it's the wind storms we've had, whatever the disaster may be, although maybe more localized, again, like an earthquake is localized in a certain area, not as widespread as a pandemic, which permeates every aspect of our society, but still people have reacted in a positive way, saying, what can I do to help? Where's the shovel? Where's the wheelbarrow? What can I do to move some trash out of your yard? What can I do to bring some food to those who need help, in particular those who are vulnerable, those who are aged, those who are sick? We've looked for opportunities. That's been part of our culture. Well, guess what? We're being tested today like we've never been tested before to see if that same kind of enthusiasm to help our neighbor exists during a pandemic. And we're doing good in many ways. We're coming up a little short in some other ways. This is a clarion call to let's redouble our efforts. It's third quarter time. We got to get ready for the fourth quarter. Let's see what we can all do to do our part. If we'll do that with the right attitude, not an accusatory blame, criticism, kind of sending kind of approach that we see too often, which I believe is, by the way, the minority of our population. They're loud, they're strident, but they're the minority. The silent majority's got to step up and help, encourage them to participate and be part of the solution and not part of the problem. All of us have that responsibility to take a look and say, what can I do? I'm looking for ways to improve my own performance. What can I do to make things better? Let's be part of the solution, not part of the problem. Thank you. Good luck. God bless. We're going to win this together.
All right. Thank you, Governor Herbert, Dr. Dunn, Dr. Spivak, and Director Justine Lee. This is concluding the briefing for Thursday, October 8th. We appreciate our interpreters in Spanish and in American Sign Language, and we will talk to you later. Thank you.
Thank you.